Welcome to Let's Talk Mental Health, where we bring awareness to the causes and solutions of mental health conditions. I'm your host, Nathan Nedley, and I'm here with Cami Martin, who has recently written an article entitled, "I'm Not Okay, But Don't Tell Anyone, Unraveling the Mystery to Change the Mental Health Crisis." A very interesting read, and you go over quite a few statistics in this article, and let's look at some of those. What are some big statistics that we're seeing right now that have to do with the mental health crisis?
We're seeing that in the United States, 1 in 5 adults is actually living currently with a mental health illness. And in the European Union, these statistics are even more severe. 1 in 4 adults is experiencing at least one serious mental health disorder every year as well. And among young people, ages 18 to 25, so young adults, it has an even higher significance of or prevalence rather of mental illnesses at 25.8%. So that's, just slightly over 1 in 4.
Wow. And then also one statistic that I saw that was very shocking, those who suffer with mental illnesses die on average 25 years earlier than those who don't suffer from a mental illness. So we're seeing not only are more people suffering, but it has a drastic implication on length of life and I'm sure quality of life as well.
It is. We can think about disability, for example. Mental health illnesses, obviously being on the rise currently, are now among some of the leading causes of disability across the world. And in looking at global statistics, it's now the 4th leading cause of the global burden of disease. As well, in addition to the problem of disability.
Wow. So we have this significant problem. We're seeing that mental health disorders and illnesses are on just this kind of skyrocket upward. And now on the flip side, the healthcare systems that are supposed to be helping these people maybe they're in place, but what we're finding is that people are not going there. And can you talk a little bit about that and the statistics we're seeing of people finding care for those issues?
So among those that are suffering from mental health illnesses, some of the recent statistics that are out are showing that 70% of those individuals are not accessing health care. And it's really unfortunate because we look at how prevalent mental health illnesses are from the stats we just looked at, and 70% of these people are not accessing health care. And there are different posed ideas of why this can be, and some of those include a lack of knowledge about what mental health illnesses are and their treatability. So that would be the first thing. The second thing could be just ignorance about how to access health care and what treatments are available. And then, unfortunately, prejudice against people that are suffering from mental health illnesses. So prejudice is a big reason. And then just that a 4th reason that people are expecting that there will be discrimination if they admit that they do have some sort of mental health disorder.
Stigmas exist, meaning there are barriers that are existing. What are some barriers that we're seeing dealing with mental health conditions on a personal level?
Some of the questions or thoughts that go through people's minds related to these barriers would be like, I don't feel like I can trust a medical professional. And in this instance, when it comes to mental health disorders, I want to encourage people with the fact that medical professionals are well educated. They're not being paid off by some big business to sell just one particular drug or something. Physicians, healthcare providers are trained with the best interest of patients in mind, and so I just want to bring about some of that just reassurance that they have the best interests of the patients at heart, and that there are professionals and trained volunteers that are able to deliver truly evidence-based measures that will be able to help individuals with the very personal nature of mental health illnesses. And so I encourage people to give it a try, even if there's been some negative experience someone in their family has had. That does not mean that all medical professionals are bad or something like that. It's not something we can globally say that all people are bad just because of one or two negative experiences, not to diminish that some things are unfortunate perhaps that people experience, but to give people another try when it comes to the medical world.
Right. So let's look into kind of to close off the impact that an individual can have. And I know we were talking some about intentions and the ability for people to make a difference by just being, first of all, knowledgeable, and second, being willing to share some of the vulnerability that comes with having a mental health condition. And maybe you're not struggling with it now, but in the past, and opening up to some people really provides an area for others to open up as well. And I think that can have a huge impact. I don't know what you've seen.
It absolutely can, because at the end of the day, whether we're dealing with public health, global health crises, like the mental health crisis that we're facing in our world, at the end of the day, these numbers are all made up of individuals. And you and I and those that are watching, our friends and family, we are individuals, and we can change statistics if we make choices ourselves. We like to suggest informed choices, and informed through the education that we intentionally seek, learning signs and symptoms of conditions. But through this education, we can change ourselves. We can make strides towards breaking down barriers, whether it's not learning to trust healthcare professionals, realizing that it is worth putting some financial sacrifice into ourselves if it's going to benefit us mentally, whether it is recognizing that there are options available that are holistic, that are evidence-based, things that we can implement practically into our lives, whether it's lifestyle, nutrition, exercise, different things that influence our mental health. Gaining an understanding for ourselves about these things, what we can do, what choices we can make, will influence our lives. And if we share some of this with one other person, and if every one of us does that, we can change global statistics. And that's really exciting. And then we aren't islands that are suffering from depression, anxiety, panic, or other related conditions. Instead, we're in it together, but can change statistics as well as a result.
Right. Well, I loved how you closed your article with the call to action of break the stigma. Thank you for your time, Cammie. And this is Let's Talk Mental Health. I'm your host, Nathan Nedley. And as always, stay healthy, live happy.